Like all new businesses, Oscar Insurance was designed to solve a problem. And the problem here was trying to make it easier for people to get insurance and understand how it works.
Right. And yeah, they positioned it basically as a tech-savvy insurance company. So you were going to book appointments on your iPhone, you were going to text with the doctor, and it was going to all come together under the Obamacare exchanges. So it looked, I mean, especially during the aftermath of the Affordable Care Act, like an amazing business. They raised a ton of money.
They raised a ton of money, but like other insurers, it soon started struggling, and it has lost money since then.
Yeah, they've lost a lot. They've lost more than $300 million since January 2014. And the thing is, they just didn't get the membership that they wanted. That's one thing. The other thing is it's hard to make money in health insurance.
So what now? I mean, how much are their businesses tied to the health of the exchanges? Of course, they're not the only ones who didn't get the signups expected. Right. It's a national phenomenon. And if that's weakened further by whatever the final version of healthcare reform happens, what does that do to Oscar?
Well, what's interesting is, so they're mostly dependent on exchanges still. And what's really interesting is they're expanding. While Anthem just pulled out of Ohio, Oscar is going into Ohio with this partnership with the Cleveland Clinic. So they're going to be in 5 counties in the Cleveland area. And that's basically a bet on Obamacare. And what's interesting about it is it's kind of like counterintuitive, because you'd think you'd be sort of waiting it out, waiting to see what happens. But they're sort of betting on the idea that whatever Trump does, whatever the Republicans do, it's going to look a lot like what we have right now.
What's the alternative if they don't make that bet?
They don't really have an alternative,
yeah,
because their business is really dependent on this model. I mean, they are doing other things. It's probably important to say they have in April they started a business program, but it's pretty small. So really this is them kind of going with what they know.
Yeah. And Oscar also has teamed up with other local hospitals as well, right? It's not just the Cleveland Clinic.
Yeah, what they're doing, it's actually pretty innovative. I mean, they're basically doing this risk sharing thing in New York and in Cleveland, and also I believe in Texas and California, where hospitals are in a sense not getting paid for every procedure they do.
So we know about the challenges on the exchanges, all the different things going on with health insurance. What about this fundamental value proposition of making it easier? The idea that healthcare could be as easy as downloading an app. Does that work?
You know, I asked about this, and it's really hard to say, mostly because costs have been going up so much. So, like, the cost of procedures, of drugs, it's kind of washing out any sort of small gains you might make. I do think the idea is sound, but it just hasn't borne out quite yet.